Dr. Barnes here, board certified psychiatrist. Today we're going to go over Depakote versus lithium in bipolar disorder. This is actually a really important question to ask in the field of psychiatry. These two medications have a very large role in the treatment of bipolar disorder in getting folks relief. So what is exactly the protocol in choosing these two medications? I'm going to give you the mindful medicine approach. Generally speaking, lithium is considered the gold standard, is considered the superior of the two medications. It's one of the few mood stabilizers that's very good at not only depression but also mania. And you ask anybody that's taken or prescribing these medications, they'll tell you it's kind of difficult to ask a medication to be both an upper and a downer, so to speak, where lithium checks both boxes. I would say maybe lithium is more of a higher risk, high reward medication, but both certainly come with some risks that you need to be aware of. I think a more complex question would be, when would it be appropriate to choose Depakote over lithium? And there's a couple circumstances where I do that. Number one, if medically lithium is contraindicated, let's say there is renal disease or hypothyroidism or any type of thyroidism, quite honestly, you may potentially stay away from lithium. Also, you may choose Depakote in another scenario in a mixed episode, or somebody that struggles with bipolar mixed episodes, or rapid cycling. Mixed episodes meaning you have features of all phases of the mood disorder at once, and rapid cycling meaning in a 12-month period you have shown different parts to the bipolar depression, mania, or mixed. So I hope this kind of helps. I will end with one other very interesting study that did suggest that lithium may be superior to Depakote, but when you analyze the study a little bit more clearly, you'll see that part of why lithium may be so good is that it does require more frequent blood monitoring. And it's thought that because of the frequent blood monitoring, they are now being in touch with their clinicians more often, they're talking to their doctors more often, and it's thought that that interaction with the clinician brings intrinsic value on its own. Hope that helps. Hit me up in the comments.